When we talk about antibody tests for COVID-19, we simply don't know or do not have enough information at this time to say, oh, if you're above this cutoff, we know you're definitely immune. We're still conducting that research, and that's why rushing to conduct antibody tests can be problematic because we just don't know what guidance to give patients based on their results. Generally speaking, when you're infected with a virus like COVID-19, you do get lasting immunity. You have to clear it first, obviously, but once you do, you will have lasting immunity. With chickenpox, for example, it's lifelong immunity. With measles, if you get both vaccinations, lifelong immunity. With COVID-19, we just don't know how long that immunity lasts. It could be months, it could be years, it could be lifelong. Right now, the general thinking between the leading experts in the world is that if you have an intact, normal functioning immune system, you get COVID-19, you clear it, you will have lasting immunity to protect you, but we don't know how long that immunity lasts yet. There are so many antibody tests on the market right now. There's well over 100 of them that the FDA hasn't taken a strict look at. And because of that, patients are potentially getting inaccurate information, or at best, they're getting accurate information, but not practical information with something that they can actually use. Having the presence of antibodies in your bloodstream does not prove immunity. What it tells you is that you have likely had COVID-19, but it does not tell you how severe your case was and did your body mount a strong enough response to be considered immune. We will get this information in the future, but not yet. In fact, there's a three-step process here that we need to really respect. First, we need the FDA to step into high gear and really figure out the exact research and methodologies behind all these tests and become strict so that we're not just running amok and testing patients with poor quality tests. Second, this is the most important step. Know that when we're conducting these antibody tests, like what we're doing in New York, this is not for individual guidance. This is not to change what an individual person will do based on the results of these tests. This is simply for us to get a better sense on a large scale of how many people have had COVID-19. Because the recommendations we give to a specific city or state will change depending on how many people have been infected with the virus. And then the final third step is going to be, once we've tested enough people and our research is really good, we'll be able to say, oh, if your antibody level is above this threshold, you're definitely immune. But that third step is a long ways away. So please do not rush to your healthcare provider to be tested for antibodies, because the amount of information it's going to give you on a practical level is practically zero. The only reason we should be conducting these antibody tests right now is for surveillance and future guiding purposes like we're doing in New York State. We need to figure out who's been sick. We need to figure out where we can reopen first. And for those type of research purposes, we absolutely should be making use of antibody tests. But to say that individuals should be going out and getting them for themselves to change their practices, no. You're still going to be socially distancing yourself. This is not a security blanket for you. This is simply the fact that you are positive, but it doesn't mean that it should change what you should be doing.